For those of you who may not know, there is currently a bidding war going on between two very big companies, Novo Nordisk and Pfizer. They are fighting over a company called Metsera. Initially, Pfizer came out and said, we would like to purchase this company for $7.2 billion with an option to go up to $9 billion. And then Novo Nordisk came out and said, actually, we want to buy Metsera and we're going to offer them $10 billion. This is something that is heating up very, very quickly. Metsera, what do they actually do? They are a biotech company, shocker, being bought by another biotech company. And they have, shockingly enough, their product is a weight loss drug. Metsera is making a weight loss drug that is a GLP-1, just like Pfizer and just like Novo Nordisk. Novo Nordisk already has a GLP-1, and I think it's Wegovy. If not, it's Ozempic. But basically, Novo Nordisk has Ozempic, but they want to purchase Metsera, who is developing another GLP-1 drug, which, at least according to this article from Biospace, it is a better GLP-1, basically, with 7.5% reduction in body weight at day 36. So about a month and you lose almost 8% of your body weight, which, hey, you know what? That's a little bit better than some of the GLP-1s that are on the market right now where they're, rocking around maybe like 5 or 6%. They're also, one of the other big things that Metsera is developing is they are developing basically an oral GLP-1 instead of injections. They are developing a GLP-1 injectable, of course, but they're also developing an oral thing that you can take instead of just injections, which if someone could develop a pill basically that did what the GLP-1 injections did, I think that you would see a lot more acceptance of it. And so I think that's why, these two companies are sort of fighting over Metsera so hard. This is a kind of a big deal if you can get a company that has phase 3 trials of a drug that is performing very well. That is basically just a better GLP-1, and then they also have stuff in the pipeline that's like, oh, you could do this orally and you could get a lot more money. One of the angles that Pfizer wants to take is a popular angle, America first. In the multi-billion-dollar fight between Novo Nordisk and Pfizer is now going to the government and is saying, hey, we think that you should let us buy this company, Metsera, because of America first. It's cool that that's the world that we're living in right now, where a company can just go to the government and say, hey, actually, we think that this is politically advantageous to us. And so we think that the FTC should step in and stop Novo Nordisk from buying Metsera, and you should let us buy Metsera. Also, let us buy it for a cheaper price. Despite the fact that Metsera has already agreed to Novo Nordisk's offer of $10 billion. It's a sign of a new world order for the pharmaceutical industry in which manufacturers hope deal-making and political overtures made directly to President Trump translate into favorable treatment from the administration. And the reason why they believe this is because other companies have done the exact same thing. Obviously, we had earlier in the year, we had Apple bringing a $150,000 gold bar to the president, and then the president of the United States of America gave Apple an exemption to the tariffs for all of their iPhone parts. And this has happened with tons of companies. We do sort of live in this world where if a company is able to convince the president of the United States to get on their side, then he just kind of like does whatever he feels like. The FTC has already cleared Pfizer for acquiring this company because obviously they announced that they're acquiring it a month ago. And so Pfizer is suing through the FTC. Novo Nordisk merger agreement would violate U.S. antitrust laws given the company already owns Wegovy and Ozempic. Basically, Pfizer's case is, hey, Novo Nordisk already owns the two biggest GLP-1 inhibitors. Why would you allow them to buy Metsera, which is a company whose literally only product is a better GLP-1 inhibitor? Instead, Pfizer is saying you should let us buy the company, which, I'm going to be honest, it seems like that's a pretty reasonable thing to say. Do we really want to give this company that already owns the biggest GLP-1s another GLP-1? Like I said earlier, both of these companies also just reported earnings, and Novo Nordisk is currently fighting a sort of internal battle as well. Novo Nordisk also just got a new CEO, Doudstar. One of his big things when he initially came into the company was he is cutting 9,000 jobs from the company. So Novo Nordisk employs 78,400 people. They are cutting 9,000 of those jobs, so about 11 to 12%. And shares of Novo Nordisk are down a lot this year. They're down about 50%. Of course, this company, there was a lot of hype at the end of 2024 concerning a lot of their GLP-1 stuff. Once that hype around the GLP-1 drugs sort of subsided, you saw a lot of stuff fall. You saw the company fall. What's going on, this sort of internal fight of Novo Nordisk is very interesting because the controlling shareholder of the company is the Novo Nordisk Foundation. This is a nonprofit that funds biotech research in the Netherlands, which is where this company is located. But basically, they were the controlling shareholder. They seized control using their board seats. They ousted the CEO, and they got a new CEO, as well as I think they ousted some other people in the chair. And so this new CEO has basically come in and said, okay, we're going to restructure the company. We're going to cut jobs. And then we're going to make an acquisition, which we're going to try and get Metsera. And they're going to try and, continue to get back to where they were a couple of years ago with all the GLP-1 hype. Novo Nordisk reported earnings, and they didn't do so well. While operating profit is growing and revenue is also growing, it is only growing in the high single digits as opposed to last year, where it was very high double digits. And so we're seeing the company sort of struggle, even though they have sort of like the miracle drug, right? Ozempic and Wegovy. These are GLP-1s that have incredible value. They're not necessarily seeing the demand. There was initially a thought that if you could do this like miracle drug of the GLP-1, then you would make $1 trillion, right? And it turns out that it's not necessarily the case. And it could very well be because this is an injectable, and injectables are scary. People don't like needles, and so they're far less likely to actually engage in this treatment. However, if you have a company like Metsera who is developing an oral GLP-1, then you might find that $1 trillion miracle drug. Also, they are in a two-man race with Eli Lilly, who's developing Trulicity, and they are having a much better time getting prescriptions for Trulicity as opposed to Novo Nordisk, Wegovy, and Ozempic. On the other side of the trade is Pfizer, who also reported earnings last night. And Albert Bourla, who is the CEO of Pfizer, they're also sort of doing the same thing. Pfizer invested a lot of money in 2020 and 2021 and 2022 with a vaccine. They made a lot of money during that period, and since then, they have struggled to sort of continue to make that revenue again. They're restructuring the company a little bit. They're also cutting costs. They're cutting jobs. Now they're also looking for sort of that miracle drug where they want to go out, they want to buy Metsera, they want to get this company. So Pfizer, it would appear as though Pfizer is in a better position to actually go out and buy Metsera, specifically because they already have a deal with the president of the United States. They sort of have already done the political maneuvering in order to get special treatment. So Pfizer said it includes a one-time $1.35 billion charge tied to its licensing agreement with Chinese biotech 3S Bio, which had earnings by roughly 20 cents per share. The company said in 2025 guidance also accounts for President Donald Trump's current tariffs on China, Canada, and Mexico. It does not reflect Trump's threatened pharmaceutical-specific tariffs, as the company is exempt for those levies for 3 years under a new drug pricing deal with the president. Pfizer's basically said, hey, we're going to make a deal where we're going to work with you on certain drug pricing if you give us an exemption from tariffs. And so I think it is an important idea to remember that Pfizer is sort of already in the room with the president and is sort of already making deals with him. What that sort of means for Metsera is it's currently trading at $7.76 billion. Pfizer's offer is, I believe, $8.1 billion. Here's a really good example. We were talking about this on Monday. Officially, as of right now, there is an offer from Novo Nordisk that has been accepted by Metsera for $10 billion to purchase the company. And so in theory, you can go out and you can purchase Metsera for $7.76 billion, for every share that you buy. And then when Novo Nordisk actually finally goes through with their offer to actually purchase the company, they're going to pay out all of the shareholders approximately what would be worth $10 billion, as opposed to where it's trading right now, which is $7.76 billion, which is, I think that works out to about $100 a share. So you can go out, you can buy for $73 a share, and if Novo Nordisk gets accepted, then you get paid $100 a share, which is great. You're literally getting paid to sit around and wait 6 months. But what the market is saying is they do not actually believe that Novo Nordisk is going to be able to purchase Metsera, and they instead think that because of Pfizer's already sort of deals with the president, that they're going to be the ones that are going to be allowed to purchase the company. And so Pfizer's deal is $8.1 billion, as opposed to $73 a share. You're more likely getting paid $79 a share. And so there is a little bit of money to be made here, but nowhere near as much if Novo Nordisk gets accepted. There is this sort of fight that's happening that a lot of people might not recognize as happening between Novo Nordisk and Pfizer. Pfizer making the case that hey, we should do America first, and Novo Nordisk already has all of these other drugs. We shouldn't allow them to have Metsera, which could be like the literal miracle. Meanwhile, both companies are struggling to refactor their whole company for the future, basically. You have Pfizer, who's cutting jobs and restructuring their company a little bit to make up for their losses from losing a lot of their money from 2020 and 2022 and 2021. And you have Novo Nordisk, who has the actual board of directors who have stepped in and have said, hey, you need to do something about the direction of this company because we clearly overestimated how well Ozempic and Wegovy would actually do. And so those two companies are sort of fighting over Metsera.